Well, South Korea has introduced some of its strictest COVID measures so far to cope with the Omicron wave. And while the public has largely cooperated with restrictions so far, more voices are calling for the freedom to go about life as normal and say no to vaccines, including teenagers. Frank Smith has this report from Seoul.
South Korean high school student Yang Dae-rim and his friends don't want to get vaccinated. Neither do many of the 23,000 followers of his YouTube channel. His live streams emphasize risks associated with vaccination while downplaying the benefits and argue the government's vaccine pass violates their human rights.
No one knows what the future side effects will be. Questions about whether it is effective are growing because there are many cases of infection with Delta variants and Omicron variants even after being vaccinated. So individuals should decide whether or not to get the vaccine. I don't think it's right to be disadvantaged for not being vaccinated.
From February 1st, teenagers will have to prove vaccination or a recent negative COVID-19 test to enter libraries, private academies, cafes, and other facilities. Yang argues that the government should be focusing its efforts on the elderly and not the young.
The high mortality rate of the elderly can explain the justification for the vaccination of the elderly. But the fatality rate for young people is low, and yet the side effects of vaccines are many, so I don't know why young people are vaccinated.
Some South Korean parents have also mobilized, together with support from some doctors, to protest against the vaccine pass. A mother of 5 children, Kim Soo-jin, is even taking the case to the country's courts.
I think the vaccine pass policy is against constitutional law. It's a serious violation of children's right to learn and violates their right to education because they can't go to the library or private academies because of the vaccine pass.
As South Korea scrambles to provide care for the record number of serious cases, H+ Yangji Hospital's 34 COVID ICU beds are full. Infectious Disease Department head E.G. Young says that while vaccines may cause some side effects, he supports the vaccine pass and stresses that the risks of infection for the unvaccinated are far greater.
Vaccination prevents 60 to 90% of infections. And when a breakthrough infection occurs, that person is 90% less likely to die or require severe treatment. The media should not spread fake news or insignificant news, but deliver the voice of medical professionals to the public.
For most South Koreans, the medical community's message on vaccines and the vaccine pass seems to be sinking in.
I think that it's fair because individual freedoms are guaranteed only so long as they are not infringing upon social safety. So I believe people should get vaccinated as soon as possible to use public places with a vaccine pass.
The vaccine pass was introduced for adults December 6th. South Korea is now dealing with its highest surge of the COVID-19 pandemic, with more than 5,000 new cases per day for weeks. As the debate over vaccines and a vaccine pass for the nation's youth continues, the Omicron variant may cause those numbers to rise.
Jerome Kim joins me now from Seoul. He's the Director General of the International Vaccine Institute, an independent non-profit international organisation based in Seoul, founded by the UNDP. Mr. Kim, thanks very much for joining us. Clearly, vaccine hesitancy is a problem in South Korea, but it isn't only there. What more can be done to convince vaccine sceptics?
So, as a medical professional, we always believe, and I think you heard one of the physicians earlier say, we need to have the right information. But we actually need to do more than that. We've been presenting the correct information about the ability of vaccines to reduce infection by 5 times, to reduce hospitalization and death by 10 times. We can talk about the risk of severe complications of COVID infection in the unvaccinated versus the vaccinated. And we've talked about it, and we need to be forceful about that message because Omicron is adding a new level of danger because it's coming on top of a Delta outbreak that has already filled the hospitals in Korea. So we need to be more forceful in the messaging. We need to change the messaging. Now, you heard about the newspapers and the television, but are those reaching the people who we need to target now? The high school children, the kids in high school. So that young YouTuber with 26,000 followers, are we putting the messages out there, the correct messages, the ones that emphasize not only rights but responsibilities, not only to protect yourself but to protect others? These children will be going out and meeting their family over the holidays. Are they going to make sure that the people they meet aren't going to be a victim of lack of vaccination and lack of protection?
That's true. I mean, obviously the messaging is important. Combating fake news, for example, is really important. But there are studies to show that it doesn't, in fact, work to convince people by telling them all the statistics and showing them that getting vaccinated is a good thing. I mean, especially if the root of vaccine scepticism are more sort of moral intuitions, gut feelings, etc. What else can be done apart from the messaging?
So I think that this is where governments have a number of tools available to them, and governments have to be very careful about the way they deploy these tools. But, you know, to some extent, what is the alternative? We have several alternatives. We can continue masks and distancing. We can encourage or require vaccinations, or we can require vaccinations only if you want to do particular things. If you want to go to these after-school academies, if you want to go to a noraebang, which is a Korean version of a karaoke venue, then you need to be vaccinated. But in addition to that, you know, so having these requirements puts a restriction not on your ability to do things, but only on your ability to do things that put you and other people at higher risk.
Right. So putting social curbs is important.
Exactly. And I mean, and we really, you know, we talk about vaccines as the solution. Vaccines are a part of a very important part of a layered defense. The first line of defense is, of course, the things that people need to do, right? The masks, the distancing, avoiding crowds. Vaccines may be the second line of defense. After that, we have medical care. Well, the medical care system is full now. So what other options does a country have? They can do as countries in Europe have done. They can lock down again. Korea's never locked down. People have always had.
Mr. Kim, I'm really sorry to interrupt you, but we're running out of time. And I did want to ask about whether or not this is largely a first world problem, in that many people from richer nations where vaccines have been readily available don't seem to want to take them. Do you see less hesitancy in developing nations where they often or perhaps frequently don't have access to vaccines?
So I think it's important to remember, though, that Korea, being a high-income country, does not have a big problem with anti-vaxxers. So it also depends on the country. But yes, it tends to be less of an issue. But increasingly, as the supply of vaccines through COVAX and other mechanisms is becoming greater, we're seeing the emergence of some resistance to vaccination in lower and middle income countries as well. And this is particularly problematic because some of the other things that would support patient care if a person became infected are not present in low-resourced healthcare settings. So vaccination is even more important. And we need to work again on messaging and getting governments behind the idea that this is a very important thing for everybody in society.
All right, Jerome King, we'll have to leave it there. Thank you very much, Director General of the International Vaccine Institute.